I don't have words that express the gratitude that I think we all have for her doctors and just continuing to care so much about her.
Hi, this is Patrick.
And this is Laura.
And you're listening to This is Cancer.
Brought to you by Siteman Cancer Center at Barnes Jewish Hospital and Washington University School of Medicine in St. Louis. National leaders in cancer. As a parent out there that might see the description of this episode about childhood cancer, I know it might seem really, really difficult to even press play on this podcast. But once you meet Addie and hear her voice, you will see that some beautiful things can come out of a really scary, horrifying situation. And this is how my voice starts to crumble already. Just introducing.
Keep it together.
Addie, say hi to everyone.
Hi.
Thanks for coming on the show.
Thank you for having me.
Addie, how old are you?
I'm 12 years old.
12 years old.
And Addie, you're not by yourself today. Who's come with you?
I have my mom, Ashley, and my child life specialist, Nikki.
Thank you guys for coming today.
Hi. Thanks for having us.
Thank you for having us.
And Addie, you hadn't seen Nikki since about June. So the minute you saw her, but when you were walking into the studio, you guys were so excited to see each other.
Yeah. Like teen squealing. Eee! Big hugs. Yeah.
Happens every time.
Every time. I think we did that even during treatment, too, where it was like every single time we'd come in, hug.
Yeah.
Yeah. We were so excited to see each other.
So it's been a little over a year since you all first started coming to St. Louis for treatment at Siteman, right, Addie?
Mm-hmm.
And Mom, it's okay if you cry during this because that's what we do as moms, and it's okay. So a little over a year ago, your journey started when Addie started getting some headaches in about October of 22. Is that correct?
Yeah. She just woke up one morning with a debilitating headache, and which wasn't out of the norm. She actually used to get, we would call it her Monday headache. She would seem to have headaches every Monday, and I would pick her up from school, but it didn't raise any cause for concern until she woke up one morning with a headache that wouldn't go away. Nothing would touch it. And she actually got up the next morning, was going to go to school, and started vomiting along with her headache, which definitely raised red flags for me. We took her into the doctor. We were in and out of the doctor's offices for 2 weeks, and they just kept telling us, it's a virus, which was weird because nobody else in my family was getting sick.
And this is still in Central Illinois?
This is still in Central Illinois, yeah. I had this pit in my stomach, and I knew, she wasn't eating. She couldn't get out of bed. She was throwing up constantly. She didn't go to school at all for those 2 weeks, and I was at work one day. She was going to try to go to school that day, and I was driving her, and she was like, I can't go, Mom. So I work in a hair salon. I'm a hairstylist. And so I just took her to the salon with me. She was in the back room, and I was so unsettled that day. And I left work and was like, I'm taking her back to the hospital. That's when they said they had found a mass in her brain, and they were going to take us down to St. Louis Children's immediately that night. So that kind of rocked our world. They ended up having to do surgery that night.
Oh, my gosh.
Which they thought it was going to be the following Tuesday. They ended up having to do it that night, which we were very relieved because then she was so sick. She finally got some relief from that.
Gosh.
Just from the pressure being relieved, I guess, literally, right?
I was so sick that I didn't have any medicine or whatever, and I was just so angry with everyone. And that was once we got there, right? Mm-hmm. And it was so bad.
You were agitated.
Mm-hmm. Mm-hmm. And I don't really remember. I remember waking up for a couple seconds. Everything was blurry. I don't remember anything. After that, after I blanked again, then I was up the next morning from surgery.
Walking around.
So it literally just went like that.
Mm-hmm.
Crazy. So you got there and they said Tuesday, and then they changed that to this evening.
Mm-hmm. Yes. So then from there, she had her recovery. I think we were there for maybe 4 or 5 days. We went home, and I still don't even know, I couldn't tell you what the name of her tumor was, but I remember getting the phone call from Dr. Shatara that it was a tumor that they had just recently discovered in Germany. And she is the first one that they've ever treated at Siteman with this kind of tumor.
So when you found out that this was a rare tumor, What was the treatment plan? Where we would go from there? Because there had been surgery to remove it, but were there margins left, or were there?
The night that they did surgery, they were actually prepping us for like a 8-hour surgery. So Matt and I, my husband and I, did our best to get any kind of rest, but they ended up coming up in about 5.5 hours and said that everything was good and they had clean margins. Her surgeon said, everything looked pretty clear on the scans, and he was like, we got in there and it was so cut and dry. They were able to remove everything. So from there, we came up with the treatment plan of 30 rounds of the proton radiation, which was how we got to meet Nikki. And Adeline's little brother, who is 6, he was asking about why we did proton radiation. And he was like, is it... He's like, is it in case they left any crumbs? And I was like, that's like the perfect way of putting it.
I was there, and me and my mom looked at each other. We were like, what?
Yeah.
Yes.
So.
Yeah. So, Nikki, you met Addie, Adeline, but you go by Addie, right?
Yes.
So it's okay that I call you that. Yes. You met her when this treatment process was supposed to start, correct?
Yes. So I met her at her consult. And actually, I use that now, just so you guys know, in case there's any crumbs behind with my younger kids. So thank you. It was Braxton, right?
Yes.
Yeah. I actually use that. But we say that when they have clear margins and they've gotten all of the tumor and the disease out, that we call radiation the insurance policy. So it's to ensure that we get any of those microscopic cells that maybe were left behind, just to make sure that nothing comes back. And so my job as the trial specialist in radiation is to kind of assess during that consult, see how Addie's coping, see what she knows already, what language they use. Have they used the word cancer? Are they using the word tumor? Create prep books for both her and her brothers.
I remember that.
And just kind of be a big support, not only for her, but for the entire family, because it's a family battle. So that is kind of how I got involved. And then I joke around, because every time I meet a new kid, I say, I'm going to buy your love in the beginning, and then you're just going to love me after like 2 days anyway.
Oh, it's so true. It's so true, though. I remember that day that you pulled me and my little brother, because my parents had to talk to some doctor about something. So then you pulled me and my little brother out, and we went into your room, and you had a bunch of toys. Braxton was just all over them. And then you were just talking to me and him about what's gonna happen, and making sure that I understand everything and everything that happened and stuff.
Yeah, kind of going through. So we have a great team over in radiation. So when Dr. Perkins needs to have bigger, more serious conversations with parents, usually I'll take the kids out and we'll go. And I have really great prep videos. And then I have they gave me one tiny room for all my toys and to make it kid friendly. And then we just go in there and we talk about things. I answer whatever questions they have. And then we generally just have fun and do normalizing activities just to make it not so scary and just to get to know each other too.
Yeah,
so
somebody to trust, so that it's not every time I come to this hospital, I'm going to feel traumatized or feel mad or scared.
Yes. Yeah. So I label myself as the safe person. So I never do any pokes. I'm always there to support you. Whatever you need, you let me know, and I will go find who needs to answer questions, make it better, and to sprinkle all of the wonderful toys.
That's right. So you said she got proton therapy, 30 rounds. So what does that look like, and what does it do?
So it's completely open. So the bed is just kind of floating in the middle of the room, and then the machine is built into this conveyor belt, and it goes around you. So the bed just gets to move back and forth, and we can set it to whatever angle that we need it to, which we do move the bed several times depending on the treatment plan. On the regular side of radiation oncology, there is an entry and an exit. On the proton therapy side, it's really special because, and especially for the patients who are having treatment to their brain, is there is an entry point, but we can tell it to stop. So we can save all the healthy tissue behind it that doesn't need radiation, because that wasn't where her tumor was. And that has a lot less side effects when we're saving all that healthy tissue around that.
Is proton therapy, it's rather new, correct? This is not something that's been in cancer care for 20 years.
Yeah, it's new and it's kind of rare too. So like we have patients travel hours and hours to come and get proton. And there are not very many in the United States. So we're pretty lucky to have that.
And you probably just stayed here in St. Louis.
We did. We actually were lucky enough to get an apartment at the Ronald McDonald House.
So. It was very cozy, very warm. We got a bunch of decorations for Christmas and stuff in it. I loved it.
Yeah,
when I was there,
really
it was
good job taking care of folks.
They really do.
What is that like to be a mom where all your focus and energy is going towards one child and you have 3 other kids to be present for or try to be or give them some normalcy? What was that challenge for both you and your husband?
For me, it felt very overwhelming. And I think I told you yesterday, I feel like any symptom of ADHD that I possibly ever had in my life has been on complete overdrive in this past year. Anytime something remotely comes up with her, I feel that instant, I can't focus on anything else but her. So having 3 other kids at home, you feel torn. I am constantly, we judge ourselves as moms so hard anyway.
Yes.
So trying to manage my time of taking care of a sick child and then taking care of 3 busy other kids is so overwhelming.
How did you and your husband kind of balance that together? Because I'm sure you also dealt with it differently because you're 2 different people, not just a man or a woman, but just different people in general. How did that work for the 2 of you?
He does a very good job of grounding me. I tend to be the overly emotional, honestly, even sometimes avoiding, and he is definitely more factual and realistic. So even with her initial diagnosis, I did 0 reading on it because I know myself and I know that I can't handle those things. And he just kind of quietly in the background will have that knowledge of reality. I feel like I tend to be our emotional side, and he definitely brings us back down to earth.
And how did your brothers handle all of this as it was unfolding?
Well, my brothers were I feel like my brothers really do show emotion to my parents from things that I've heard, but things that I've heard from my mom. But
allegedly they have emotions.
Yeah, in a theory, I don't know if it's true. But they told me this, that people would come up to them in their grade and my grade and above me, 7th, and they're in 8th, so they'd every grade asking them how my sister is and how I am and stuff. Well, yeah. But they'd be like, oh yeah, she's fine. I honestly would hate if they were like, how is your brother? How is your dog or something? I would just be like,
Yeah, I know.
You just feel nervous having to answer.
Yeah, you don't want to get all the backstory in it because then it's
yeah, a lot of attention deep. Like that can be kind of,
yes.
Can make you feel kind of shy or overwhelmed.
That's how I am. When people are like, oh, wait, what's your story? Or people at school, it's
What were some things that friends did or said that really helped you? Or what were things that from a social standpoint were really things that stand out?
When someone would ask me about it and my friend would be like, not right now, she's literally doing something. Or I don't know why. It just because then I'm doing something, they're like, oh, wait, what was your story? And I'm like, I have papers to do. So then my friends would just be there and be like, not right now.
You got my friends, built-in bodyguards?
Yes.
From all the impromptu interviews?
Uh-huh.
Adeline, can you please tell? She's coloring right now.
That's right.
She's coloring her Dora paper. Be quiet right now. No, but I feel like my friends were always there for me, and they didn't really be mean to me when I was there, which was really helpful because I had so much stress when I was going back. I was like, oh, what would people think about me? Are they gonna ignore me? I was terrified to go back to school.
It's a really hard age. You're in middle school and you're going through this, and you're already middle school is just in general. I don't know a lot of people that are like, dude, I loved 6th, 7th, and 8th. It's the hardest years of your life.
So awkward.
I don't know. I had a pretty good time. 6th,
Whatever,
7th, 8th
Patrick.
grade. But I
You
was
don't know
just a
girl
stinky
drama.
boy, and I did not
Patrick,
care.
you don't understand girl drama in middle school. It is
still
legit
Vicious.
Real thing.
traumatic. I mean, it's
Vicious.
brain
it's
tumors are traumatic,
bad.
but so is girl drama.
Yeah.
Oh my
Yes.
gosh. Sometimes it can be like traumatizing.
Yeah, I know. After you had the surgery, it took several weeks to even get the pathology back, right? And the doctor calls you and tells you that she has such a rare tumor that you don't even really know exactly what it's called. Is that right?
That's correct. So Dr. Perkins had given me like an abbreviated form but I don't know if it has an official name. I'm not really sure.
And Nikki, what did you say when you looked up?
In her chart, it just says brain tumor. There's not an official diagnosis like there normally would be.
Wow.
So,
You know, to hear that, like, we don't have a name for it, it's like what NASA says when they, like, find a new planet.
Right.
You know, like, they think they have something like this in Germany, you know, which I guess I could see that being scary, but, like, I don't know, maybe it's also a good thing that, like, maybe it's easier to treat than other ones. Like, maybe it responds better than other ones. You know, I guess it's
Well, it was a clean cut, right?
right, you know,
yeah.
like,
Honestly, that's kind of the route that my mind takes
Yeah.
is I'm going to take this as a positive and it's going to be like the best kind of tumor that anybody could ever have.
yeah, which so far,
I mean-
having had the surgery and proton therapy, and that was essentially the extent of your treatment, right?
Yes.
I mean, 30 rounds of proton therapy,
Yeah.
but 30 rounds of proton therapy, a clean margins after surgery, and now you've got 2 scans under your belt that have been clean? 4?
We had our first one February and then June, August, and now. So that's 4, yeah.
Nice.
What were some things, I know you mentioned what helped you with your friends, which was basically bodyguards, to be like, back off, don't ask her about it, right?
Yeah, because it kind of like choked me up for like the first like month because I'm like, oh, that not happened to me. And then I thought about it. I'm like, oh, don't really want to talk about that. Let's think about the positive.
Yep.
But you seem pretty good talking about it today. Why is that?
I don't know. I feel like I'm just more comfortable about it because it kind of happened so like fast and so like quick and like I don't remember a lot of it, so it's just like hard for me to talk about it when I don't know much about it and I don't really know how things are gonna end up. And like after everything has been like good and I've gotten 4 good like scans that said everything's good, I feel better talking about it because I know that everything's going a lot better than what it did about a year ago.
Would you want to know anyway? Like, you know, for me, half the time, you know, I don't care, you know? Like, it's like you said, when you're getting your treatment, you're like, I don't know, it took 15 minutes and I got out of there and then I went and did something else, you know?
Yeah.
That's how I try to do it and be like,
Yeah.
look, I don't know, I went and sat down and they did whatever they do and then I'm just going to go back to, like, doing what I'm doing.
Yeah, I just like, oh, I gotta go in this hospital, gotta make sure everything's good, gotta get all those, what Braxton would call crumbs out, and then just do what I can do that's fun and keeping my mind off what happened in the past
Yeah.
and looking more to the future.
What helped you, Ashley? What helped you and Matt the most when you guys were going through this? Because it's like every parent's worst nightmare.
Honestly, I feel like I have felt kind of more like Patrick, where I knew the reality of the situation, but just keeping like, this was an opportunity for her and I to spend so much quality time together. And it was a terrible kind of situation, but we had 6 weeks where it was just her and I, and my sister would come down every now and then, and we just tried to make the best of it. I know that the outcome of whatever situation is not in my control, so I'm doing my best to just stay in the moment. We just tried to have fun. I guess that was how I coped with it, was by trying to have fun.
What kind of mom are you now, or your husband is a dad post-diagnosis? Anything changed?
For sure. I'm still trying to put these things in place. I I definitely feel like I'm a more anxious mom than I ever was.
I was going to say that. You're more like,
Yeah.
that doesn't seem very safe. She's like,
Addie, your nose is running. Oh my gosh.
Seriously.
Yeah.
Anytime the girl's like, I don't feel good, I'm like, oh my God.
do we need to go to the hospital?
But I try really hard to be in the moment because anything could happen at any time. So why not just enjoy what is right in front of me?
Mm-hmm. What about you, Addie?
I agree with my mom, but like sometimes I like to worry, but like also don't. It's like, I don't know. I kind of like, if I hear something, I'm like, oh no, and then I'm like, oh, that's in like 3 weeks. Like, why am I worrying about that right now? And then it'll come up to like a day before, and I'm like, okay, just breathe. You'll be fine. Like MRIs like terrify me. So like when I like didn't really think about the MRI, and I'm like, there's not gonna be an MRI. I always knew there was, but and then like a couple minutes before, I started getting like really anxious because they are not done. And then I'm just like, we're not in there yet. I can worry about it when I'm there, and then it'll be over. And when I'm in the MRI, I'm like, just watch the movie. Nothing's going to happen to you. Your mom's in the room. There's doctors everywhere. And they'll be fine. And then I'll get out there and I'm fine. So,
Yeah. You're letting your thoughts control your feelings, right?
yeah.
Yeah. Nikki, what about you? Has it changed any of you're around these amazing, great kids and families every day. You have 3 kids of your own. Has it changed how I don't know, you've probably been a parent the whole time you've been doing this, so.
I have been since I've been in this role, yeah. I mean, Addie, just listening to you and what you're saying, like, I'm fine, it's going to be okay. You don't know how spectacular you are. Not every kid, you've been doing this for a year, not every kid can do that. Not every kid can compartmentalize what you're going through. Like, oh, I can't worry about this now because it's not happening. Like, you are phenomenal, and I am so grateful to know you. I need you to know that. As a mom, I have people ask me all the time, how do you do this? How do you do this? And I am so grateful that I get to be in these families' lives and to make it a little bit easier for them. But also I do go home and squeeze my babies a little bit harder. And I try to let the small things go that are, really silly and trivial. And then I get up and I go and take care of my babies again at work. So I'm really lucky.
What was that like? Do you remember the day you got to ring the bell? What that was like?
It seemed like this is actually happening. Like my nightmare's over. Like it was over, and I'm like, after this, all I have to do is checkups. All I have to do is just go there and hear them say, "You're good," like always, "You're fine," and then get to see the people that I love there, and enjoy spending time in St. Louis, and that's all I think about. And then when I rang that bell, I was so excited, and I went straight to my grandpa because he's so emotional. And then I hugged him, and I was just so happy to be done with the hardest thing probably.
For you to be able to have your thoughts truly control how you feel is work. It is like a decision. It's a tool that a lot of people don't have.
I had to work for it very hard because after all that happened to me, holy cow, I had such bad anxiety.
Yeah.
And fear from being away from my parents. That first day back at school, I was terrified to be back in school, to be away from my parents for 3-4 hours. That scared me. But I always came home and I was always so excited to see my parents. And it's just enjoy school, enjoy being with your friends, and you'll go home and see your parents. When you're with your parents, you enjoy every second that you have with them. And I realized that anxiety is just a mindset, and it's your mind taking over everything, every part of your body, and it's just just let it go.
Mm-hmm.
So can we ask what you got planned for the future? I think maybe podcast hosting could be something. something you could do? Maybe a therapist?
You can teach
My
everybody
friends.
how to do that.
My friends totally has like, oh my God, you're the therapist in the group. And it's like, I don't want to be.
No.
Not at this age.
What do you want to do?
I realized when I was in the hospital, like, the nurses, like, are the ones that, like, actually, like, make it look like, oh, this is not that bad. Like, you're fine. Like, we're here for you. Like, we understand it all. Like, we've seen it all. And it's, like, so amazing. And it, like, made me feel like, oh, it's fine. Like, I'm fine. Like, everyone here is, like, good. And, like, I'm with my parents. And, like, I want to, like, work at the Children's Hospital here and help other families, like, make their nightmare the best that I can make it, and make it more like your kid is fine, like, everything will be okay. I want to be, like, a PICU nurse. So, like, the kid is, like, on watch, like, every hour.
Pediatric intensive care unit.
Yeah. And I want to help families there too, because that's probably scary, having your kid in the PICU, knowing that they're going to have their kid watched, like, every hour, on the hour, like, make sure nothing happens. So I want to help families in that situation, and also help the kid be, like, not so afraid on, oh, I'm going to, like, poke you with a needle. Like, more like, oh, I have a toy, but there's one thing I have to do before you get the toy, and, like, before, like, you do something, like, something like that.
You know all
and,
the
like,
tricks. You might have noticed this too, but I've kind of noticed that there are so many really talented people in the medical field that are in that field, in that position, because they went through something like that, or somebody in their family went through something like that. It's just, there's so many people, not everybody, not everybody is doing it specifically for that reason, but there's so many doctors and nurses and therapists and stuff like that that are kind of, in a way, trying to fix themselves or fix something that their family went through for somebody else's benefit.
Yeah. Nikki, we were talking about that before we started recording. What made you want to become a nurse and a child
life specialist?
Yeah.
Yeah. So I was hospitalized as a child for just a couple of weeks, and it was very scary. There was not anyone there to explain things. Everything was terrifying. It was not child friendly. And it really, even a couple of weeks in the hospital stays with you. So that's why as soon as I found child life, I knew immediately that's what I'm going to school for. That is what I have to do with my life, because the thought of children going to the hospital and going through these traumatic, what can be very traumatic procedures, and not having an advocate there to help them through it and explain things so that they're not so scared, and then kind of help teach them, coping techniques to be able to take with them if they have other procedures when maybe a child life specialist isn't there. I knew I had to do that.
What would you guys say to another family going through, that's looking at going through something like you guys did? Like, you guys came all the way from Central Illinois for care at Siteman for a reason. What would you recommend to somebody that might be going through this as well?
I definitely feel like we are in the best care possible with the doctors and nurses and everybody at Siteman, and Barnes and St. Louis Children and in general. As far as coping with it, I just keep going back to try to find the good in every situation. And I know that sounds really kind of cheesy and hard to do in a really terrible situation, but that is honestly what got me through it. And I'm still working through this, but instead of, like, fearing what the future has, try and flip that into, like, a positive about, I'm excited about her future instead of I'm scared for her future,
Yeah.
excited for this inspired her. Yes. I feel like just trying to find positive things and enjoyment and fun.
I kind of agree with my mom in like the sense that like find the good in every situation. And honestly, I would say take it one step at a time. Like going one step at a time is like not like being like, oh, this is gonna happen. Like I know it's 3 weeks away, but I'm terrified for it. Like think about the good and like, oh, tomorrow I'm going with my friends shopping. Tomorrow I'm going to a movie or something like that. And like find the good in every day. And don't think about a month ahead or a year ahead or like 3 days ahead. Like take it day by day.
I mean, I'm sorry. I'm just shaking my head in like amazement.
Her brother even asked her. We were sitting at the kitchen counter the other day, and she was talking about a friend's situation, and he just kind of looks at her and he's like, Adeline, how are you so mature? And I think I learned from her.
Mm-hmm. Yeah.
Yeah, very, very mature, very emotionally mature.
Yeah.
And very wise. You're like a little Yoda.
I feel like what put me in that position is time can like stop at any time. So like you need to think about like the good things you can do and like the best things like you can do at a time. So like I don't know. I feel like it made me more mature because it's like this can't happen like every day. Like life could stop any time. Mm-hmm. And that's just how it is because I don't know. But I just had to take it like day by day, like I said, and like that happened so quickly that I'm realizing to just like I don't know, like think about like the good things and like
you're wise.
Mm-hmm. Oh yeah, don't let her fool you. She was mature like this when I first met her. But I think you have grown a lot over this last year.
One thing I want to ask about is your husband. We always think, oh, how does the mom? I would always ask, how's the mom doing? It's the mom's worst nightmare, but it's a father's worst nightmare as well, because it wasn't just you coming down here every week. He was coming down here too. He was taking care of his daughter, and we need to give reverence to that and props to that too.
I mean, he is the best support system and the best dad, and I think he definitely processes things differently than I. I'm so emotional, and I always give him a hard time because I'm like, I never see you cry. But that's just kind of he likes to keep himself busy. So when he would come down here with Adeline, they would spend a lot of time walking around the zoo. He would do homework with her. They would go, and he would take you to Barnes and Noble and get books, and so I think that's kind of how he kept himself busy. And then on the weeks that he was at home, there's no question that the 3 other boys at home kept him busy too.
Right. This will be airing during Christmas time, so paint the picture of how your family will be celebrating Christmas this year. It's going to be a lot different than last year.
100%.
It will feel different. So we are kind of homebodies, honestly, around Christmas time. And I'm just, this whole holiday season has felt a little bit more relaxed, even starting around Halloween time. And so this girl already has her room decorated for Christmas.
Love that.
She pulled out all of the decorations that we had for the apartment, and she's been listening to Christmas music for like 2 weeks now.
Okay.
But
well, the apartment, the way that like we had it, the Christmas decorations, I don't know why. It just brings in like in the good sense that we were talking about, like think about the good. It brought back like all those good memories that I had in the apartment. And I just like, I don't know, I feel so like happy seeing the things that were there. That might sound like bad, but like
No.
It was like so cozy. And I have like this thing that says be real, and someone said your room looks so cozy. I'm like, thanks. I love it.
Yeah. Well, you felt safe there. You felt safe.
Yes.
So that makes sense. Like, it doesn't always have to be looked back as you said it was a nightmare, but it seems like there were some really beautiful dreams in the middle of the nightmare along the way, right? So it makes sense that you would want to still have that part of you with this Christmas and to help reflect like the difference.
Her middle name is Joy, and it just like really fits her. I feel like she has so much joy to share with the world. So,
Absolutely. Yeah. Is there anything that you guys want to say to your doctors?
I mean, thank you for saving my daughter's life. I don't have words that express the gratitude that I think we all have for her doctors and just continuing to care so much about her. We met with her surgeon today, and he said, "I'll see you in a year."
That made me so happy.
Yeah.
It like made everything look like, okay, well, he said I'm fine. That means like I'm gonna be okay. Like I can like do what I want to now. Like I don't have to worry about anything coming back again because my surgeon that like saved my life said that I'm fine and said that I don't have to see him in like a year, which is such a big improvement, and it's only been a year. That's just crazy for me.
Yeah.
And knowing that I'm the only kid there that had that type of tumor, and like once I heard that, I'm like, oh, finally, like everything is good.
Well, when you guys come back, you can just hang out with us. I'll meet you at the zoo. It's free. We should mention that's why they kept going to the zoo. It's free. I'll walk the zoo with you. I'd love to. I mean, you can give me some more adult way of thinking about things and help remind me to look at the positives every day instead of the things that can overwhelm you. Because you saying that today was really good for me to hear. Because I've had a hard time doing that lately. So I think I was meant to be sitting here with you today and listening to you.
Yeah.
Addie's little nuggets of joy.
Yeah, that's right.
Yeah.
That's what we'll title it. We could just
sprinkle
title the
them.
episode.
Nuggets of
Yeah,
joy.
nuggets
Addie's
of joy.
Crumbs of joy. Addie's crumbs of joy.
Yes, yeah.
That's right.
Can we do this again?
How it always goes.
I know. It's very
I
therapeutic,
really wanted to
isn't
say
it?
this.
How about we all just start a podcast?
Oh,
Yeah.
I think we should.
Yeah.
I mean, you guys
probably.
easily could. You could come here. You could do like all the installments every 3 months when you come get your scans. You record your 3 episodes.
Yeah,
your
we'll
4
produce it
episodes.
for you.
sure.
Yeah,
Yeah,
nuggets
it's
of
fine.
joy.
Addie's buckets of joy.
Buckets.
That's cute.
Yeah.
Yeah, girl, you got buckets.
We're joined now by 2 members of Addie's team, Washington University physicians at Siteman Kids at St. Louis Children's Hospital, Dr. Shatara and Dr. Perkins. Thank you both for being here today.
Thank you.
What does it mean to be able to hear Addie and her mom say that about where she's at now and what it means to have your help?
I mean, we do this every day. I've been doing this for 12 years. And, to hear it from a mother and to hear it from a child just continues to put in perspective why we chose this field. That's the whole point. That's the whole point of why we're here, to not only cure Addie, but also to make this the most favorable experience for her as possible, which I know we'll talk about today. So it's really great to hear that.
I know that you are in hematology and oncology, but you specialize in brain tumors.
Correct.
So can you give us a little bit more, because we were talking to Addie and Ashley and trying to figure out, like, how rare is this tumor that she had in her brain? Can you give us, we couldn't remember even what it was called. Remember? She's like, I don't even know. It just said brain tumor in her chart because Nikki looked it up.
Yeah, definitely. So just a hint about brain tumors. So brain tumors are considered very rare tumors, but they're actually the second most common tumors that we see in children after leukemia. So leukemia is number 1, but then when it comes to the incidence, brain tumors are really just second to that. But brain tumors is not one disease in children. It's a diversity of tumors, and the list grows every year. So Addie's brain tumor is actually very rare and just recently has been described. It's called PLAG1 fusion supratentorial neuroepithelial tumor.
Oh,
and
wait,
really,
can you say that one more time? Because Patrick and I are just going, because even you knowing how to say that is impressive. Can you say that one more time?
Sure. So it was recently described as supratentorial neuroepithelial tumor with PLAG1 fusion.
Wow. So what that means is?
It's actually a very rare tumor that, as I mentioned, it just been recently described. It did not even make the most recent classification of brain tumors that was published by the World Health Organization in 2021. So it's very rare. We're still learning a lot about it. It's a tumor that occurs in children that is characteristic by a certain molecular feature, which is the fusion between PLAG1 and another gene. And that is really just recently described. Only 20 to 25 cases in the literature has been published. So even the optimal therapy is still not clear, but we, for Addie specifically, we have chosen what we thought is the best treatment for her based on what we know about these tumors. So really, it's with time, we're still learning about these tumors. New tumors are being described, so it's very diverse list of brain tumors in children, and that's why treatment cannot be one that fits all. So it's really now we're aiming toward the future of individualized treatments for our patient, and that's the reason we have a multidisciplinary care team. It's not only a pediatric neuro-oncologist, we have all specialists involved, including the neurosurgeon, radiation oncologist, neuropathologist, as well as a pharmacist in our team, because this is becoming, that's how we want to approach brain tumors in children.
I mean, although Addie's cancer is extremely rare, it is not so rare for you to have to go in and tell a family, you guys unfortunately are facing a very rare cancer in itself, because there are just so many varieties of brain tumors that children can have.
Yeah. As I mentioned, like leukemia is the number one tumor that we see in children. The second one is brain tumors.
Do you think the list is expanding, as you said, because we're just more vigilant and discovering more of them, or that children are just developing cancers at a higher rate?
No, I think we have more tools now. We used to depend on just the looking under the microscope to tell what this tumor looks like. 5 years ago, we used to do just DNA sequence. Now we have more additional testing on that. So it's becoming more complicated because we have more tools available for us to help us.
Okay.
And the impact that has, which I think is always kind of interesting, whenever we recommend kind of using chemotherapy or radiation as an example, there are some children that we treat that may not need that therapy, that they may do fine without it, but we don't know who they are. And with further study, if we know this child has this mutation that does really well, we can start to de-intensify treatment.
Now, Dr. Perkins, you're not only a radiation oncologist, but you're also the director of Siteman's S. Lee Kling Proton Therapy Center, correct?
That's right.
When you guys are meeting with families and you're doing these consults, how often are you meeting with people that are not from St. Louis?
Yeah, so we actually just published the outcomes for the kids treated at the Proton Center this year. And the average distance traveled for our families was 111 miles. So,
wow.
We certainly service the children here in the St. Louis region, but our catchment area is really a lot of Missouri and most of southern Illinois. So, again, because these tumors are so rare, they're kind of very few in towns all over. So it's really common for us to see families who are driving in a good distance to St. Louis to get their care. Of course, for protons, this is usually a 4 to 6 week course of treatment where they really have to be here every day. So for newly diagnosed families, it's a stress, and Addie was a great example. They came from much farther than 100 miles for her care and essentially had to move up here during her surgery and recovery and then remain here in St. Louis. Now that she's in follow-up, their visits are, every 3 months or so. But it's a major lifestyle change for these families to go from having a healthy child to, moving 150 miles from home for their care.
We all know that Addie is incredibly impressive. How did she and her family take the news of having this rare cancer during that first consult?
I remember definitely they were tearful, they were scared, but throughout her journey, they were really tough, that they wanted to stand strong by Addie and get her through the treatment and afterwards. I think yesterday when I saw Addie, I was asking about her schooling, and Mom said she has been advocating for herself. Like, she now has her own plan. She is very excited every time, like, she's very eager when she wants to ask to help, and she's advocating for her help. And honestly, when she said that, Addie sat up in her chair and she was like very proud that she's doing
That's
that.
right.
And, that's what we thrive with these kids. We want them to do and grow and do whatever they want. And Addie is a good example of her continuing to fight whatever, is coming through her way. And I think that experience of having that brain tumor taught her how to stand up for herself. And I take it like with pride, honestly, because sometimes even myself, I don't know how to do that. And you see that child doing that and you're like, wow, okay.
Yeah.
I'll take a point.
Aside from Addie's case, generally speaking, in the world of pediatric oncology, what is on the horizon that you are most excited about in your field?
I think every day we discover something new, and the most exciting part of it is that our ability now to provide targeted therapy for our kids with different kind of tumors, whether in the brain or outside. I think that's the most exciting part, the availabilities of many of these drugs. We, as an example, now use and it's FDA approved, oral treatments for a type of brain tumor that if it recurs, we can use oral medication with really impressive outcomes. So we're hoping that this is going to be the future for all brain tumors. We're still in the early stages. We're still not using that for every patient, but I think with the discovery we're making every day, I think we're heading towards that. And we are part of a major clinical trial consortium that treat kids with cancer in general and specifically for brain tumors. So we're very excited about that, and that's where the future is going to be, to try to provide the most perfect treatment regimen for every child.
Dr. Perkins, as the head of the S. Lee Kling Proton Therapy Center, what are you most excited about in the future of treatment in your field?
I think for me, my research focus is really on the late effects of radiation in kids. And so Margaret and I have worked on a couple grants together, a few of which have been funded, where we're going to be studying resting state MRI, which is a really interesting form of functional MRI imaging. And our radiologists at WashU are really experts on that, and our neuroimaging scientist.
Resting state?
Yeah. So when you're at rest, your brain is very, very active. So rest would mean kind of a daydreaming state. You're not talking, you're not moving, you're just kind of laying in the scanner. The brain is very active and it's very organized in its functions. So we obtain resting state MR in our brain tumor kids. And we've noticed changes in the way their brains are organized. Our hope is to start a clinical study next year where we will do that before and after proton therapy to see how radiation might affect these networks and which networks may be more sensitive to radiation. So I'm very excited to kind of bring our imaging scientists at WashU into the proton space and into the brain tumor space to start thinking about, are there regions of the brain that are more sensitive to radiation that we're not really considering right now, so that we can make our plans better for cognitive outcome? So that's
so
on the horizon. Yeah, it's really exciting. It's being at WashU and Siteman and Barnes and Children's, these people who really study this not only in humans but also in mice, where we can see how their brain is working, is making my job as a clinician also somewhat as a scientist, which is very hard, but very very rewarding, very challenging. It's great.
Well, I'm very thankful to know that Addie is going to continue having physicians such as yourself in her corner as she continues her journey forward from this cancer. And
Addie will advocate for herself.
She will. She will. Again, want to thank you both for being on the show today and for all your help getting Addie through this battle.
Yep, happy to be here.
Same. Thank you.
Thanks for listening to This is Cancer, brought to you in partnership with Siteman Cancer Center at Barnes Jewish Hospital and Washington University School of Medicine in St. Louis, national leaders in cancer.
For more information on Siteman Cancer Center, go to siteman.wustl.edu and be sure to leave us a review and like and subscribe wherever you listen to podcasts.